name is Christy Call, editorial director of Cure magazine. In this edition of the Speaking Out video series, we're talking with Dr. Jeremy Brauer from the Skin Cancer Foundation on awareness and prevention. Welcome.
Thank you very much for having me.
Anytime. So, skin cancer is the most common cancer in the country, but there's still a lack of awareness. If that's the case, why do you think there's this lack of awareness around the disease?
You bring up a great point. I think there are a lot of wonderful campaigns out there, a lot of education, the talk about sunscreen, but nonetheless, we see patients in the office who are coming in for skin exams or individuals who even have a history of skin cancer, and there still seems to be this general lack of awareness of specific types of skin cancers. And the fact that even though when treated early have a very high cure rate, if left alone or neglected, can result, unfortunately, in death.
So last year, I know the Skin Cancer Foundation commissioned a survey to try to gauge awareness for the different types of skin cancer in the United States. Can you just talk a little bit about your findings and if anything was surprising?
So yeah, to your point, I think the general lack of awareness and understanding regarding skin cancer in general prompted this study, and the Skin Cancer Foundation, along with Regeneron and Sanofi, commissioned an online survey which was conducted by the Harris poll with roughly 2,000 adults, so 18 years and older, in the United States. And they evaluated overall understanding and awareness of skin cancers in general, but also specifically asking questions about squamous cell carcinoma, basal cell carcinoma, and melanoma. And a lot of the interesting findings revolved around cutaneous squamous cell carcinoma. One thing that I found very interesting is the majority, or almost 3/4 of those that were surveyed, were generally unaware of cutaneous squamous cell carcinoma. And just over 40% of those had never even heard of cutaneous squamous cell carcinoma. And to put that in perspective with melanoma, that same number, that just over 40%, were somewhat unaware, but only, I believe, around 10% had never heard of melanoma before.
Okay, and so why do you think it is that individuals are less aware of cutaneous squamous cell carcinoma versus melanoma?
So there are a lot of hypotheses or theories behind that. One is there's no dedicated cancer registry for squamous cell carcinoma compared to melanomas. In general, most individuals do not consider squamous cell carcinoma or even non-melanoma skin cancers as deadly, whereas melanoma, we know, is deadly. And I think we hear about it in the news of celebrities and famous individuals, politicians who are diagnosed and unfortunately pass away from the disease. A lot, as I've mentioned, of the more recent advances in treatment have revolved around metastatic melanoma. So I think they're all important. I think they all raise awareness for skin cancer, and specifically for melanoma, but it does paint to some degree the non-melanoma skin cancers, so specifically basal cell and squamous cell carcinoma, as the good, if that's the, people look at it as a good skin cancer, when in truth, there is no good skin cancer. These skin cancers, similarly, if left alone, while they may not metastasize and cause destruction and death throughout the body, they absolutely can cause invasive damage locally and cause death that way as well.
Right. And so going back to kind of the awareness aspect, what do you think is the number one thing that we need to be raising awareness on right now then?
So I think people need to understand that there's no such thing as a good skin cancer. It is a cancer, going back to the first thing that we talked about, cancer regardless of the organ. Skin is an organ. So whether you're talking about breast or prostate or lung, and I should also mention, since mentioning all three of those, squamous cell carcinoma, there are more of those diagnosed in the United States every year than all three of those cancers combined. So 2 of the top 3 cancers in Americans are skin cancer, number 1 being basal cell carcinoma, and number 2 being squamous cell carcinoma. So it is very prevalent. And the good news is, if we're aware of these carcinomas, these skin cancers, and we pay attention and we do our best to prevent them, those numbers can drop significantly. Additionally, if you are diagnosed with a skin cancer, or you do notice, again, something new, changing, or unusual, early detection and intervention results in nearly a 99% cure rate. So I think it's very important that individuals are aware of what to look for, or even once they do notice something they are aware of and they know what to do and who to call. because I think that's how we're going to get these numbers down.
Absolutely. And so as a part of awareness, I know we talk a lot about, sunscreen and things like that. How can an individual determine if a product is actually sun safe, though, in preventing sunburns?
The Skin Cancer Foundation has done a lot of great work with this, working with federal government and industry. And so as mentioned earlier, the most important thing when looking at a sunscreen label is looking at whether or not it has both UVA or ultraviolet A and ultraviolet B protection. For a long time, we focused on the ultraviolet B, which everyone more commonly knows SPF, sun protective factor. And while UVB, ultraviolet B, is the one that causes not just skin cancer, but sunburns, UVA also can cause skin cancer in addition to more of the aging of the skin. And so that's why it's very important that we're protecting against both UVA and UVB. In general, though, we should still look at the number, the SPF. And while most will say a minimum of 15, I tend to tell my patients a minimum of SPF of 30. So again, that's only protecting UVB, but a minimum of 30 applied appropriately. So depending upon what your activity level is, applying appropriately throughout the day is the best way to determine which sunscreen you should use.
Okay. And so the foundation has Destination Healthy Skin. Can you talk a little bit about what this is?
I absolutely can, because I was fortunate enough to be a part of it. So Destination Healthy Skin is a fantastic program. It's a mobile education and detection RV. It literally is an RV that drives around the country. I think it accumulated over 10,000 miles the most recent summer. And you have the ability to sign up, come on in and get a total body skin examination by a board certified dermatologist. So I was fortunate enough to do this in Midtown Manhattan, and also educate individuals. So those that maybe weren't interested in getting a skin check, there's lots of materials available right outside the RV. We have the opportunity to speak with individuals and answer questions, and it's a really great program.
Great. And in addition to those efforts, the foundation has also, lobbied before. Can you just talk about some of the areas or examples of what the Skin Cancer Foundation has lobbied for and how others can get involved?
So the Skin Cancer Foundation, in addition to the Big C campaign, and we just talked about the RV, the mobile unit, they work tirelessly with local government, federal government to raise awareness, look toward methods for prevention and detection. And in some of these, more specifically, you're talking about the tanning beds, right? So we talk about prevention. We know that a history of use of tanning beds before the age of 35 significantly increases your risk of developing skin cancer. And so they've made great strides and worked tirelessly to institute, if not outright bans in underage tanning, reduction in use overall, and just changing a lot of the laws both locally and nationally. And I think that was a really wonderful accomplishment. And we did discuss also the sunscreen. So there's been a lot of focus on sunscreen, both at the national level and international level, looking at specific ingredients. And the Skin Cancer Foundation has been involved in that conversation from the very beginning. They also have their own seals that they're placing on, that they, along with industry, have been placing on the labels to also make it more user-friendly, if you will, for consumers, understanding what is considered a safe SPF, and do they have that seal of approval? Is it a sunscreen? So is it an active seal? Is this one appropriate to be used if you know you're going to be spending countless hours outside and active, or a daily use seal if it's going to be going to and from work? Is this a more appropriate sunscreen in that instance? And also working with the FDA. So the FDA has approved, and believes that physical blockers, namely zinc and titanium dioxide, are safe and effective, and are to be used in sunscreen. But they're also looking to gain more information with the chemical sunscreens. And the Skin Cancer Foundation is right there, both applauding that effort and also helping and aiding in any way that they can.
Great. And so just to kind of bring it all together, what would you say is the best way for others to get involved and help raise more awareness around this disease?
We live in the day and age of social media. I think it's a much more interconnected world. And I think anytime individuals, educate others and speak about their own experiences, it only empowers others. So if you are someone who has survived or was diagnosed with a skin cancer and did take the appropriate steps of seeing your board certified dermatologist and getting the appropriate treatment, whether it was Mohs surgery or electrodesiccation curettage, speak out about it if you're comfortable. Let others know that this is an experience that might sound a little scary up front, but at the end of the day, your skin cancer was cured by the actions you took. Similarly, I think raising awareness through education, the Skin Cancer Foundation website and the resources they provide are fantastic. The Destination Healthy Skin, the campaigns that they've put on. I think all of these things are great ways to continue to educate and raise awareness around skin cancer.
Well, great. Thank you so much.
Thank you very much.